Hi everyone, I have graded your written assignments as well as your discussion boards and posted feedback in the rubric for you to review. Please take the time to go in and read that feedback that's provided. Please know that if I continue to see that you're making similar errors from paper to paper, that I'm not going to continue to give you feedback in areas for improvement. It's important that you make changes as you move through the course so that you're growing and you're applying new ideas. Sorry, that was Madeline. Gracie's on the floor and they're wrestling, so forgive me if there is more barking. This assignment to write 7 practice questions was pretty complicated, and lots of you took different approaches. Some of you used standardized tests questions from multiple sources. Some of you were brave and wrote your own, which I think is great. I think a mix of both is always good. I'll tell you that in practice, it's really recommended that you do a mix of standardized questions as well as developing your own. Writing good test questions, for those of you that braved the waters to write your own, it's time consuming to do it well, to properly construct a test question, but then also develop your own answer keys that provide the rationale and the sources for your information so that when you're meeting with students, you can provide them feedback on why the answer that they chose was incorrect. It is a arduous process. So if this was a difficult task for you, that's okay. I've been teaching for about 7 years now, and I still struggle with writing good test questions. And I write test questions and then I send them to peers, and I ask my peers to make the time to reread my test questions. I'll be right back. Sorry, this is Gracie, and Gracie was just chewing on the arm of my rocking chair. And this is Madeline. Further proof that I really am teaching with a bunch of dogs around. All right, girls. So think about how you're going to approach test question development when you are in practice and having to write good test questions. Use your resources. I will encourage you. I think one of your classmates reminded me, and it was Jennifer Rickerby, that to remind you all that the bank of test questions that often come with textbooks are available. Many of the publishers have had their publishing material hacked, and their answer key banks to their test questions are leaked out onto the internet and can be purchased between $25 and $30. So if you make the mistake of starting a course and you use nothing but test bank questions that are written by the publisher, there is a high likelihood that a student in the mix who doesn't act with integrity or does so out of desperation, lots of reasons people cheat, that those test answers may be out there. So that's another reason to use test banks with caution and really do a good mix of using your own test questions and developing your own test banks with a mix of standardized sources. Okay, one thing I will caution you on, and I saw this with several of you, and I know that many of you took these questions from a standardized bank, whether it was an NCLEX model or Kaplan or even test books. There are questions that will give you data sets about a patient's condition and then ask you to have the nurse determine what the problem is. And the answer selections are medical diagnoses. I want to caution you to not use test questions that ask a nurse to make a decision on what the medical diagnosis that they're facing. When you are dealing with a collection of symptoms or data, and you want your nurse to make an action or to make a summary of why these data sets are relevant, what you want them to do is to identify a nursing diagnosis that's appropriate for that patient's collection of symptoms. Again, when you read a test question, I want you to make sure you're not asking a nurse to do things that are outside their scope of practice, like write an order, like diagnose a patient, like determining what order is appropriate. The appropriate orders can be a safety a safety concern. So if you're asking the nurse to evaluate a physician's order for appropriateness for a patient, nurses should know an appropriate dose for certain medications or an appropriate IV drip rate for a diagnosis. But just make sure you're keeping it tight and you're focusing on nursing practice, nursing diagnoses, and the scope of practice. And our questions don't want to mislead our nursing students in the wrong direction of thinking that they have a wider scope than they actually do. When you prepare for next week, your paper is going to be based on your own philosophy of clinical evaluations. I want to remind you that the primary purpose that we do clinical evaluations for our nursing students is to help them develop safe practice. Folks, it is all about the patient. The reason we continue to give formative and summative feedback for our students who are in a clinical setting, and we're constantly giving them that feedback, is because we want them to first provide safe patient care under supervision, but we want them to develop safe practices. So I want to remind you that as you develop your own personal philosophy, that we need to keep the patient and safety at the center of that philosophy. Read those instructions carefully. Know that this paper should be pretty doable and it should be well supported. So you should have your own reflections and your own experiences, but it should be supported with scholarly sources. I expect to see level headings, scholarly references, and good writing syntax as you move through that process. If you have questions or concerns, folks, know that I'm here. I know that we're heading into week 6 and it's the end of the summer, and many of us are trying to get... Gracie's chewing on my rocking chair again. Many of us are trying to get our kids back ready for school and finish up summer vacations and wrap up all the loose ends that August brings us. I know you're weary and you're tired. Hang in there. We've only got 3 more weeks and you will be done and you will be one step closer to being completing your MSN journey. So know that I'm praying for you, know that I'm thinking about you, and guys, know that I'm here. Don't hesitate to send me an email or touch base if you have questions or concerns. I hope you guys have a great week. Take care.